Hello, my name is Jeff Stauffer, Community Relations Director with Elville & Associates, and welcome to our webinar today, Planning the Health in Your Retirement, presented by Dr. Michelle Fritsch of Retirement Wellness Strategies. This is certainly a timely topic, and we're glad you've joined us today, and we're very privileged to have Dr. Fritsch with us today as well. I, along with everyone here at Elville & Associates, hope you're faring well during these times. Our office is open and we're remaining very busy, still meeting with many clients through video conferences. Our office is still open now, and we are meeting with clients who wish to do so safely through our office protocols in our conference rooms that we've implemented. So how this will work today, you are on mute. However, if you have questions, and we really want to encourage you to ask questions throughout, don't be shy. Please note them in the box on the right-hand portion of your screen, and we'll have a couple of pauses during the presentation to pose them to Dr. Fritsch. We'll also have time for questions at the end as well. And you received a copy of the presentation by email ahead of time for your convenience to take notes on if you wish. For certified financial planners and CPAs on today's webinar, you may receive 1.5 continuing education hours for attending. Now, for my records and per the requirements of the CFP Board of Standards, please email me your board ID and last 4 digits of your social security number. And this also goes for CPAs as well, as I need to have records of everybody's attendance. I'll be sending my attendance reporting tomorrow, so please send this information as soon as possible. Everyone will also receive a survey immediately after the presentation, and we ask that you please take just a couple of minutes to fill this simple survey out. It offers us valuable feedback about the presentation, and we want to continue to provide good and solid education throughout the times that we're offering these webinars in the weeks and it seems like months to come at this juncture. So very briefly, an overview about our firm if you're not familiar with us. We were founded in 2010 by attorney Stephen Elville. We have a number of different practice areas at Elville & Associates. We practice in estate and elder law planning, special needs planning, as I mentioned, elder law and elder care planning, estate and trust administration, asset protection, guardianship, tax planning as well. We have 6 attorneys, 12 staff members, and 5 locations. I'm coming to you live from our Columbia location right now. Our mission, and it will never change, is to provide practical solutions to our clients' needs through counseling, education, and the use of superior legal technical knowledge. And we focus on education a lot here at our firm. You hear that every time that we talk throughout our webinars. We do that through our planning processes with our clients, through over 100 educational workshops and webinars in the communities we serve each year, and by way of our accredited client care program. We're one of 50 law firms in the country to be accredited through the Client Care Academy in Boston, Massachusetts, and many of our clients take advantage of the many benefits that are offered throughout that CCP or client care program. So Elville & Associates, we work every day with individuals and families with the ideal of client education, collaboration, and compassion in mind. And you should expect nothing less from us at any time you work with us, or from any company you work with for that matter. And we're always available for free consultations to discuss your family's needs and look forward to being a resource to you in any way. So let's get started. We're going to offer a brief poll, which is going to pop up on your screen. And it's just going to take just about 1 minute to get your feedback. We want to get an idea of where you stand as far as your preparation for your health in retirement. So the question is, how prepared do you feel you are to maintain your health in retirement? So I'm going to go ahead and launch this poll. And you should see that having popped up on your screen. And if you can select your answer, that'll give us an idea of where we all are at right now. See the votes here coming in. Appreciate your participation. Great. And it looks like most everybody has voted, cast their votes. So it looks like 13% say very prepared, 46% say prepared, 29% say somewhat prepared, 13% say barely prepared, and 0% say not prepared at all. So it looks like we have a little bit of a varied response right there, Michelle. So I hope that's helpful for you, and thanks for participating. So I'm going to go ahead and change the screen over and give Michelle the controls so you can see her presentation. And you see
There
that?
we go.
And I'm going to go ahead and turn my camera off so I'm not a distraction. And right now it's all yours, Michelle.
Excellent. Jeff, I thank you and Steve and everyone at Elville and Associates for this opportunity to be here today. I thank all of you who are attending, and I want to tell you I want this to be a very interactive session. So please don't hesitate to chat, send your questions, send your comments. I'm pulling this up so I can see the chat as well as guide you through these slides. You've seen my bio, or you've had the chance to see my bio, but a little bit of background. I'm an old professor for over 25 years. I've taught pharmacy students, physicians, nurses, physical therapists, occupational therapists, physician assistants, all sorts of healthcare providers, and it's been a privilege to do that. I've also had a chance to practice and see patients in the VA setting for a number of years, and big academic medical centers and small community health centers. I've been able to design services for senior adults, especially underserved seniors, in a number of places. So I've enjoyed the variety. I'm board certified in geriatrics, and I'm currently in Maryland because I was part of the team that started the new pharmacy school at Notre Dame of Maryland University. So it's all of those experiences coming together, and then watching how our healthcare system is very reactive at this point. So after something happens to you, we all swoop in and do what we can to help, but I think we can prevent a lot more. So that will be my perspective today, and my perspective in my business is how do we prevent health decline in people that are healthy going into retirement and then beyond. So that's what we're here to talk about. And again, please send your questions. Let me know what you're thinking. So I like this picture. Are you ready for retirement? And many of you said you've thought about this, but I'm finding a lot of people, they've taken care of the finances or they're actively working on that. For their family, they're making those final big purchases like house and the car that can last a while. All the family is squared away. You've got excellent advisors like Elville and Associates who are making sure that all of your assets are aligned as they should be, and that there are plans. If anything changes, we know who's going to make decisions and what will happen with those assets. But I'm finding that the health part, other than just kind of your regular annual doctor visit, that there's not a lot of preventive activities going on. So I was impressed how many of you said you're very prepared or prepared, and I would love to hear from you if you learn anything today that you feel is going to make you even more prepared to sustain your health into retirement. So what I'm finding is people often have retirement dreams. And let me stop here for a second and say retirement does not mean go home, put your feet up, and watch television for the rest of your life. But I see retirement as the end of your primary career, and then that transition into something else. And we will talk several times through this presentation that I think this can be a number of things that really take your gifts and your skills and your interests and your passions and turn them into things that probably give you greater flexibility in life, but also let you pursue all of those things. So again, retirement is not put your feet up and stop, but it's transition. And I find a lot of people have great dreams and big plans, but time goes by fast. They're very focused on their succession planning, leaving their current position and either their own business or their employers well positioned to transition when they leave, but they don't put so much emphasis on themselves and their own self-care and their own preparation to be physically able to do the things they want to do in retirement. So the due diligence, we spend a lot of time and effort strategically planning and taking care of things for our business and again for our family legally, but I'm finding a lot of people are not doing the same for themselves. So the big things we'll talk about today. There are some common pitfalls. They are the things that took me out of academia and had me start this company because I saw a need to get in front of this and help people avoid these pitfalls, to develop a strategic plan for retirement, to think about, well, how do we change over time? I think I mentioned I'm board certified in geriatrics, which means my healthcare emphasis is people 60 and over, and things are different 60 and over. So we're going to talk about why and how there needs to be specialization in that area. How do we preserve our health, particularly in today's healthcare climate? And I have to tell you, when I first typed those words, it was pre-COVID. To say it now, today's healthcare climate, oh my goodness, let's get into that a little bit today, just how different things are. And then how do we navigate today's healthcare system? Both the nuances of our system and now all of the changes during quarantine or during this reopening phase. So we have lots to talk about. I want to really emphasize that when I think about health, it's way more than your physical health, way more than your diagnoses, way more than do you have the virus or do you not. And I think our mental and emotional health is being challenged these last few weeks more or differently at least than ever before in so many ways. Our spiritual health is a key component. I've known a number of people who are physically very fit. They eat well, they exercise well, they're very secure in who they are, very structured in how they live their life. They've got a big social network, but there's a hole in that spiritual health, whatever that looks like for that person. So I've learned that any one of these areas, if it's not healthy, then the whole person is not as healthy as they can be. And again, COVID has brought so many new elements to this broader picture. If that makes you think of something or leads you to questions, again, please use the chat. I'd love to know what you're thinking. So our health through life. I want to make the point that medications are a big deal and they're involved a lot of the times. So we're going to kind of go to a dark place for a minute and then I promise we'll come out with some brighter, happier information. But I want you to think about people you've known who had health events that really waylaid their plans way younger than that should have happened. And again, unfortunately, I'm sure we're all going to be able to think of those examples, whether it be a heart attack, a stroke, a significant fall, memory lapses or changes that are occurring, so many different things that could come into play here. And I'm proposing that life past retirement, there are a lot of preventable things that happen that lead to those negative outcomes. And I find that at least 80% of the time, medication plays a role in that. And I'm drawing that conclusion again from all of those years of practicing in big health systems and small health systems and clinics. I've seen countless patients in a situation like this. Now, I'm not saying that the medication is the only culprit or the only important variable, but I find it plays a role. And that can happen in so many ways. Someone taking too much of a medication, thinking, well, if one is good, two is better. Or someone not taking their medications either because they just forgot or they purposefully chose not to take them any longer for whatever reason. Or someone being on a medication that interacts negatively with another, or a situation where a medication could have helped, but the diagnosis had not been made, so the medication had not been prescribed. So lots of different ways. But again, I find that medications are somehow part of people falling into these pitfalls that completely change their plans for the future. I don't want that to happen, so that's why I do what I do. I believe your retirement years should be a time to focus on great relationships, a time of adventure, and be very fulfilling, that it focuses on those passions and those skill sets you've developed over time, and it's that chance to leave a new legacy. What I'm finding is happening, and what led to the creation of this business, is that the divorce rate after 50 is going way up. There's this subset of people, and it's larger than it needs to be, that seem healthy into retirement, and then there's a rapid decline. The accumulation of disability much sooner than that needs to happen, as well as a very disturbing rise in suicide. And that is happening in particular with boomer men in their mid 50s to mid 70s in this key time frame, which is that time of big transition. We could talk for a long time about why and how that absolutely breaks my heart, because talk about preventable. I believe that with some different planning and support and that more broader health picture, that number can come way down, and that's one of my reasons for being, is to try to bring that number down. So I believe that you should have quick access to information you need when an acute healthcare situation arises, someone you can call who can guide you as to what to do. And the same is true with those big, scary diagnoses that none of us want to receive, but occasionally we do. How do you navigate that? How do you find your way through the healthcare system and make really important decisions at a time when you're so emotionally exhausted? And then how do we coordinate all the pieces and parts of your healthcare into one place? There's one group I'm working with that, because of their occupation, they have healthcare information in a number of places. And one of the things they're most excited about is just pulling all of those pieces together, cleaning it up, making it chronologically correct, make sure the information is correct, and having that available at any time or place for them, for any new healthcare provider that they might see, making sure that their whole healthcare team is on the same page. So I'm going to stop here for a second, Jeff, and ask, are there any questions that have been asked? Anything anyone wants to talk about?
At this time, Michelle, we don't have any questions. Everyone, if you have questions at this time, this is one of our times we're pausing. So if you have a question you'd like to pose to Michelle, please do so, and we'll make sure it gets passed along to Michelle.
Yeah, we'd love to hear from you. And in 2 more slides, we're going to do a second poll to get a little bit more information. So I'll keep going, but again, please post your questions. I would love for this to be interactive. So the idea is that you move into the next phases of life with a really comprehensive team. So certainly with you and your decisions, your choices, your preferences, your family on board, your primary care physician, and any other healthcare providers, specialists, other people that are part of your care. That can be your physical therapist, your dietitian, so many different people. And then that needs to align with your financial plans and your financial advisors and your legal team, making sure that what is being put together as part of your plan matches these preferences and all these other pieces. And then I believe retirement wellness strategies is an important component for this advanced strategic planning for your wellness and health moving forward. We work very closely with your doctors, not trying to replace that in any way. But I will tell you, well over 90% of the time, I find when I work with clients that their doctors are not on the same page, do not know precisely what those medication regimens are, what those health issues are. Jeff mentioned how important education is for Elville and Associates, and I agree. The biggest part of what I do is educate and help people approach their healthcare team asking the right questions. So that's one of my questions for you. Let's go ahead, Jeff, and do that second poll. Now, do I keep talking through the poll, or do we pause for a minute?
Yeah, let's go ahead and pause for just a minute, Michelle, and I'll go ahead and launch that poll. Just take a moment. So the question we have is, how do you prepare for a doctor visit? I'm going to go ahead and launch that, and the choices are: I just show up, I take my medication first.
That should be list, I'm sorry.
I'm sorry, Michelle?
That should be I take my medication list.
Oh, okay, I gotcha.
My typo.
That's okay. I take my medication list. I take my medications and some home readings.
Like blood pressure, blood sugar, weight.
Okay, and then lastly, I have a full preparation process. So just take a minute to note your best choice, and we'll get some responses there. Okay, another few seconds. And a very varied response rate here. Michelle, 28% say they just show up. 24% say I take my medication list. 28% say I take my medications and some home readings. And the other 20% say I have a full preparation process.
Wow, I am impressed. Thank you for that. Thank you for participating in that poll. And I'm going to encourage you, be ready to be interactive, because I'm going to ask you some questions here in just a couple of minutes, and I would love to hear your responses.
And Michelle, we do have a question. Would it be okay if we pose the question to you since we're on a bit of a pause?
Absolutely.
Okay. From one of our good friends here at the firm, suggestions for maintaining social contact during a pandemic.
That is a great question, and I think it's more important than ever. At the same time, this virus has not gone anywhere. You know, we hear things about opening up and relaxing some guidelines, and I think some people have interpreted that as the risk is over. And unfortunately, that is not the case. And so I think we've got to stay the course of being as socially active as we can, but wearing those masks and staying 6 feet apart. I know people are so tired of hearing it, but it's essential. And if you have particular risk factors, anything that's lowering your immune response, whether it be because of medications or disease states, any sort of obesity, diabetes, and high blood pressure, those seem to be worsening outcomes. If you have risk factors, it's going to be extra important to truly stay away from a lot of people. I'm thankful that we have technology and we can have these video meetings. If your families and friends have not started meeting regularly via technology, it's not the same, but it's a whole lot better than being alone and not talking with people. I also love some of the things I've seen where the family pulls up in the car and the people they're visiting are sitting in the driveway, you know, so they're distanced, but they're in the same place and able to talk and have a conversation. I think there are a number of ways to do that. Even if you've got loved ones that are in assisted living or nursing homes, they're being so careful right now. But they'll often bring your loved one to the window and you can speak through the glass, which adds that protection. So It's probably not the answer you wanted. I still encourage great caution, but staying connected to people is vital. If anyone's interested, I do a short COVID update, kind of what's happening with the science each Friday afternoon. But one of the things we've been talking about is we're not used to living like this. And so fuses are getting shorter. There's evidence coming of abuses in the home, domestic abuse, child abuse, elder abuse. We believe that substance use and abuse is going up. It's very hard for people trying to recover from addiction in these times. So this is complex. And one of the best things we can do is not ignore each other and let each other be inside those walls and not check in and make sure things are all right and give people a chance to talk through how difficult this really is. So that was a really long answer. And let me know if that didn't really answer what you were trying to get.
Well, thanks, Michelle. One more, if that's okay.
Sure.
We just have actually a comment from one of our friends at the firm, a remarkable advocate for seniors in Howard County, who very happy to see you on the webinar here. She says, thank you for making the point about the importance of geriatric specialty care. People take their children to pediatricians because there's an understanding that children's systems are different. So are older adults. People need to be educated about this. Thank you.
You're welcome. And that was the perfect segue to where we're headed next in the presentation. So I'd love to hear more interaction about that. All right, is that all of our questions for now?
I'll have one more, just jumped in. How big a factor to health do you consider loneliness to be, and how can we combat it?
You hit the nail on the head. It's a huge factor for health. It gets into that mental and emotional health. I know a number of people right now that are just riding like a roller coaster. Their emotions are all over the place, or they're just really, really depressed, not necessarily diagnosed depressed, but just all of their energy is just sort of subdued. And neither of those is healthy. It gets into that emotional health and the mental health piece. I know for some people, anxiety levels are greatly heightened right now. I know for some who struggle with depression, this loneliness is leading to even darker, deeper depression. So it's an enormous piece. And again, why I think we need to be very purposefully reaching out to one another and checking on each other, and at least doing phone calls or video chats to stay connected so people don't feel quite so isolated. I think it's at least as big of a deal as some of the physical health risks.
Thank you, Michelle.
You're welcome. So let's talk a little bit more, and then we're going to get really interactive. So everybody be ready. So coordinating your care means understanding how to navigate our current healthcare system. You know, it was changing rapidly before COVID came, and now everything is different. And so it's especially important to have some guidance as to how do you interact? Do you go to the emergency department? Do you go to a walk-in clinic? Do you schedule a video call? How urgent is this? Should I try to manage it myself? Questions different than we've had to answer pre-January. So a lot of things are changing. You want somebody that can coordinate and advocate for you, especially if you're trying to navigate something difficult in the healthcare system, new diagnosis, new symptoms, something that you just don't know a lot about, and you want to make sure that you do it right. Communicating with your healthcare team, even our mechanisms of communication are changing, and our mechanisms of doctors talking to each other are finally changing in some positive ways. But you want to be aware of that and make sure that those pathways are being used. You want to be able to communicate with your healthcare team in a way that gives them the information they need to make really good choices. One of the things I have found with myself and other healthcare professionals that help people navigate is we'll teach you how to ask the right questions and provide the right information. And that has stopped the ordering of wrong procedures so many times. Because if your doctor hears a description of what's going on with you that's not clear, it's easy to make an assumption that you're dealing with problem one, when in reality, if we just explained it a little bit more clearly, it's obvious it's actually problem two. So instead of ordering tests and procedures around problem one, they could quickly focus on what's really going on. So a lot of ways this makes healthcare cleaner and more precise by communicating differently and more clearly with your healthcare team. You want to be able to get quick, knowledgeable answers to your questions, especially if you're in a situation where something acute has come up and you've got to make a decision. And then you want to know, where do your resources lie and how do you find what you need? So healthcare is so much more complex than just going to your doctor when you have a scheduled visit. And so we're finding ways to help people navigate that more effectively. So part of that is getting everything out of your healthcare visit. I know I've heard so many people complain, lament that they just don't have the time with their doctor that they want to have. It feels like that time just goes in a flash and not all of their questions get answered. And so I will tell you that I have physician friends who say the same thing on the other side. They didn't put all those years into medical school and residency and fellowship to have 7 minutes with you. They really want more. So the techniques I'm about to teach you really come from those physician friends and us kind of putting our heads together as to how do we help you get more out of your healthcare visits. And it's important for your doctor to have all the information they need to make good decisions. So we're going to talk about medications and substances and how to communicate that. We're going to talk about how things change over time and why we need to specialize in people over 60, and then understand how medications can actually cause big problems and ways to try to avoid that. So when preparing for a healthcare visit, if I remember right, at least 40% of you said that you've got a pretty good system for how you prepare for a visit. And so it could be that you already do this or something as good or better. But what I'm going to propose is, prior to the visit, and give yourself a day or two, think about what are those things that have come up since the last time you've talked to your doctor, or things that you've been working on with your doctor that have changed over time. Think about what of those things you want to make sure to address during this visit and put them in a priority list. We're going to talk in a second about taking a complete list of your medications. And then I want you to take 2 copies of this information. There are a couple of reasons for that. One is you've got your copy, and I encourage you to have a pen or pencil and take notes. As the doctor is answering your questions, make sure that you are not pressured to remember what you wanted to talk about, because you've got it all written there, and you're able to take notes as you receive your answers. Every physician I have ever worked with says if they're explaining something to you and you don't understand it, either because of the terms they're using, the pace they're going, the accent that they have, please let them know. They do not want you leaving not understanding what they're trying to communicate. And every doctor I've ever worked with is glad to pull in an assistant or slow down or repeat it again to make sure that you leave with the information that you want. The other purpose for 2 copies is you're going to have a medical assistant typically that takes you back for your appointment. And that is the person that's going to get your height and your weight and your blood pressure and your temperature. And give the second copy to that person and ask them to go give it to your doctor. It's amazing what can happen if your doctor has a chance to look at that piece of paper prior to walking in the room. He or she is then fully oriented to why you are here and what you want to talk about, and it saves precious minutes at the beginning of your visit, and it helps prevent ordering of tests and procedures that aren't necessary because you've quickly gotten them focused on what's really going on. So again, use the chat. Let me know if that's not making sense. But 2 copies, one for yourself and one for the doctor. Been educating people to do this for several years now, and I've gotten great feedback from both the doctors and the patients, feeling like they were able to relax more in the visit and really get to the heart of what they wanted to talk about. The next part is, who truly knows every medicine and substance you take? I've been doing this for almost 30 years, and rarely is the full, complete regimen actually known by your full healthcare team. I mean, very rarely. So let's go through. If you've got a list or you keep a list, certainly your prescription medicines, and that's from your primary care doctor and every other person that prescribes medicine for you. Vitamins, all the different vitamins you choose to take, those should be on your list. Over-the-counter medicines, and these are often things that you only take once in a while. You know, when you have a stomach ache, you take this medicine. When you have another event, like a headache, you take this other medicine. Those are important for both your physician, especially your primary care doctor, and your pharmacist to know about, because they are just as big a culprits for interactions and problems as your regularly prescribed medicines. Also include any supplements. There are so many things that we have the choice to go and purchase and add to our regimen that your doctor may know nothing about unless you share that with them. So supplements, herbal remedies, all natural substances, tobacco, even tobacco, whether you chew or smoke or vape, tobacco is a substance that can interact with medications. Holistic remedies and cannabis or marijuana. Right now in Maryland, medical cannabis is legal and a very rapidly growing industry. And it's anticipated that when we vote in the fall, recreational cannabis will be back on the ballot. And I've talked to a number of people who feel that there's a very good chance it will pass this time. It barely didn't pass last time we voted here in Maryland. So I want you to take a minute and think about the medication list that you carry currently. Does it include all of these things? Because they're all so important. I want to stop for a minute. I'm going to tell you a brief story and then answer a couple of questions that have come in. The story is, there was a woman. She was in her early 80s, lived alone, very autonomous, you know, took care of herself, drove, paid her bills, managed her medicines. She had no restrictions. But by the time I met her, there had been 3 occasions where neighbors had called 911 because she was outside, didn't know what was going on, didn't know which house was hers, and was very, very confused. Well, it turns out she had a little dog, and it would be in the evening when she took the dog out that these 3 occasions had happened. And this is over a year, so this is not common. But by the 3rd time, they're like, something's going on. And after a lot of digging by a great team of healthcare providers, we realized that, you know how you have those days where you just don't feel right? Either you're anxious and you just can't settle down, or maybe you're in a lot of pain and you can't get the pain managed. Well, she had some as needed medicines for pain and for kind of anxiety, and she had 3 of them. If she took any one of them, she was fine. She could go outside, take the dog out, come back in, go to bed, nothing happened. If she took any 2, and it didn't matter which 2, then she was fine. But on these 3 occasions where she had been very, very confused, she had taken the 3 together. Now, these things were things that she chose to take. They were not on her doctor's list. No one knew about them because they were just once in a blue moon kinds of medicines that she would take. And in her case, made a huge difference. So she sticks in my mind as a great example of why this full list is so important. Let me pause here. Please ask questions or give me your feedback about the taking 2 copies to the doctor and how to have a more complete medication list. And in the meantime, we have a question about, are the paper masks as effective as the cloth? And do we need to add a coffee filter insert? You know what? These are great questions. And I don't believe at this moment we have any perfect answers about the masks. We know that the N95 respirator masks are essential for our healthcare providers who are right face to face with people that we know have the COVID virus. There are not nearly enough of them for all of us to wear them, and frankly, they're not really comfortable, a little bit hard to breathe through them. So even if we had them for everyone, I think a lot of people would not want to wear them. So think about our doctors and nurses and pharmacists who are wearing them all day long. So then we come down to our cloth masks and our paper masks, and I thought I had one beside me, but I don't. They are not going to keep you from getting the virus, but that's not why you're wearing them. You're really wearing them so that as you cough or shout or speak, should you be carrying the virus and not know it, it's going to be a barrier to decrease the chances that that virus gets out to other people. Now, let's say I have the virus and I don't know it, and I'm wearing my mask, still some virus could get out. So the added benefit is now you wear your own mask. And so any virus that gets through my mask hopefully won't get through your mask. As to whether a cloth mask made of cotton is better than one made of polyester and add a coffee filter, I have not seen great science that truly gives us guidance on those things. It's just have some barrier. And if the other person has some barrier, we know that is greatly more effective than no barrier at all. There was another question about systems like Kaiser. I will tell you, Kaiser and the VA are really the models of integrated systems that the Affordable Care Act were built upon. Because you've got all of the information in one place, you've got all the providers in one place. The only limitation of that, and is in today's very fast-paced healthcare setting where doctors are supposed to be seeing another person every 10 minutes, when are they going to read all of that information? And so even in these systems, it's not always perfect because we've got to give our doctors a break and a chance to sit down and read that information and process it and be able to apply it to your care. So having all of the information available in one system, much better than fragmented pieces. And one of the good pieces of news that I kind of hinted at earlier is if systems are using the same health record system, some of those walls are finally coming down. And so your doctor in place A can now share information with your doctor in place B as long as they're on the same system. And we're starting to see some doors open, even if it's other systems. So we're finally coming to a place where your information can be more freely shared with your doctors. But one of the reasons it's been so slow is we don't want it getting out to other people. And so being very, very careful on who and how the information is shared, only when appropriate, only when needed in your care. So we're getting there. Even during COVID, I've seen progress made along those lines, which is very hopeful. 2 copies of concerns, questions, worries. Someone plans to use that for their clients and in preparation, even for telehealth kind of visits. Asking clients to write down their questions. Oh, even if with their financial planning, I agree. Thank you, Phil, for that feedback. And I agree, you can use that technique for other types of visits and preparations as well. So thank you for responding. All right, so I'd love to hear, has this changed your medicine list, what we just talked about? Or did you already have all of these things on your list? I got to tell you, if you have it already on your list, you are 1 in a million. Because I've seen thousands and thousands of patients and nobody carries this. I'm dreaming of the day when as a pharmacist, I can look and truly see everything that you take. All right, so let's talk for a minute. We're gonna get interactive. Jeff, maybe if you come on and can read to me what people are saying. Compare yourself, if you are 60 plus, if you're not 60 plus, think of the people you know who are 60 plus. What's changed since your 20s? Let's just brainstorm for a second. Tell me what you think. And you can't tell me you can't think of anything, because a whole lot changes. I'll give some hints to get us started.
Okay, there we go. We're getting some here.
Okay, great.
Weight, knees,
Weight,
brain speed, weight gain, energy level, memory, being able to pick up things from the floor.
Flexibility, absolutely.
Activity level, sex, knee pain, balance, mobility, vision, stamina, appetite. Somebody said it's easier to answer what didn't change. Body aches. I am more consistent with exercise and diet, slower mental processing, less energy, less flexibility, poor sleep, sleep patterns, let's see, ability to drive, vision, sleep soundness lessons.
Oh, we're going to talk about sleep in a few minutes. Good.
I'm looking forward to that. I think the responses have slowed down. Lots of really good thoughts. Hearing and vision, incontinence.
Along those lines, has anyone noticed that the sort of the size of their bladder changes? Got to stop a few more times on a car trip? Now, these are great, and I'm very thankful to you all for participating. I'm sorry, say it again, Jeff.
Losing things. That was the theme of my Father's Day present, or Father's Day card this year, was the fact that I lose so many things. And then 5 minutes later, I asked my wife where in the heck I left my cell phone. So.
I have a favorite song that addresses that.
Frequency and urgency. Yeah, okay, very good. Lots of great feedback.
And you hit on the highlights, absolutely. I touched my hair, but that changes. Someone mentioned, vision can change, hearing can change, especially vision seems to change for everybody. Hearing a lot of times is related to exposures. Were you a rock and roll fan? Did you work in a loud environment? And then smell and taste, we know that those are being hugely impacted by COVID, but sometimes those can change as well with aging, not with everybody, but some people. And then I want to think, when we talked about flexibility and strength, your overall muscle mass can decline. And then I want to go internal. There was some mention of energy levels and stamina. Sometimes that's medications, and we can make some adjustments for that. But sometimes our heart especially if we've had high blood pressure that we haven't controlled really well. Our heart's just not as efficient as it used to be, and that has a big impact on stamina. And then same with our lungs. Our lungs are like upside down trees, if you will, and where the bigger bronchial tubes are kind of toward the top, and then it fans out down in your lungs into what looks like a tree with leaves, but instead of leaves, it's tiny little balloon sacs. And the oxygen goes down into those balloon sacs, and then the blood comes past that balloon sac in the artery, or in the artery, sorry, and then it picks up that oxygen from the balloon sac and carries that oxygen on through the body. Well, smoking, different kinds of environmental factors, a number of different things can cause our little balloon sacs to pop, which means there's less oxygen there for that blood to pick up as it goes by. And if there's less oxygen, then we don't have as much stamina as we did before. So sometimes stamina, the biggest thing we do is ask the doctor if our heart and lung function is as good as we can make it right now, and see if that can help some of that. Exercise does help both your heart and your lungs stay more agile and more effective. And then two organs that are really important to me. When your doctor checks your blood work at least once a year, there are two things that I look at first from the standpoint of your medications. One is your kidney function, and we monitor that with two things called the blood urea nitrogen and the serum creatinine, if anyone cares, if you want to look for what those numbers are on your particular lab panel. But those tell us how effectively your kidneys are working. And all of us, the healthiest of us, somewhere in our late 30s, early 40s, our kidneys just start to very, very gradually decline in their efficacy. And then you add diabetes and high blood pressure and certain other conditions, it can go down even more quickly. So I'm always looking at kidney function because many medications leave the body through the kidneys. So if the kidneys have slowed down, then that medication is going to take longer to leave the body, which means you're going to get a bigger effect. Stop me at any point that doesn't make sense. And so I'm always curious about kidneys. The other thing you can look at on your own lab panel is they're now estimating your kidney function through an estimated glomerular filtration rate. So it looks like little e and capital GFR. And that number will tell you whether your kidneys are operating in the age-appropriate range. But I'm always looking at kidney function when I'm deciding if a medication is appropriate. And then the other one is our liver. Most medications go to our liver, and that's where they're broken down. And they have to be broken down most of the time in order to move on and leave the body. So if we don't break them down, then they're going to stay active for a longer period. So I'm always looking at liver function and kidney function for anybody that is on any medication, just to make sure that the dose is right, the timing is right, and that it's the right medicine for that person. So we'd been talking about smoking, and someone was asking if someone smoked, can they stop, and will that help? Definitely. Stopping can be difficult, but there are a number of strategies out there to help. The biggest one is between your ears, though, that decision to stop. But stop smoking within a year, there's a lot of health benefit. So fairly quickly, you see big benefits when you quit smoking. So it's not too late. It's not like all the damage is done and there's nothing you can do. Quitting at any point has its advantages, definitely. I want to talk about a new science that I think is very exciting. I believe within 5 years, we will all know our pharmacogenomic profile. That's just my personal prediction. But insurance companies are starting to pay for it more and more frequently. So it's called pharmacogenomics. So pharmaco like pharmacy or medications, and genomics about your genes. Genetically, we are all different. And you'll probably recall that the human genome has been mapped back around I don't know, someplace around 1990, I should know the year, 89, 90, someplace in there. Well, since then, we've learned a lot. Now that we understand human genes, we're learning more, and we're finding that the way we metabolize, what the liver does with those medications, genetically, we're all a little bit different. And if our particular genes are different, then the certain way that the liver deals with the medication can be different. And so knowing our genetic profile helps our doctors prescribe the right medications for the individual person. Not every medication is impacted by genes. So that's one of the reasons that right now it's not done for everybody. But there are certain types of medicines where knowing the genetic profile can be essential. If someone's had a heart attack, there's a medicine that's commonly used after a heart attack, and we've learned through gene therapy that 40% of people don't use that medication correctly. That's big. So if people have had a heart attack, almost always they get a genetic profile to guide the use of that medication. With cancer, there's a lot of chemotherapies that we need to know the genetic profile to choose the right chemotherapy. Anxiety and depression medications. I'm really excited about that category of medications because I can give you a number of examples of people that struggled and struggled and struggled to get their anxiety or depression or suicidal tendencies under control. And then we did a genetic profile and realized the medicines they had been trying can't be metabolized in them. They don't work for them. Got them on an appropriate medicine, and they've been so much more stable. So I love that. Pain medicines, the opioid medicines, are one of the categories. And I'll give you a short personal story. I was given an opioid medicine one time while in labor to have a child that was supposed to just sort of calm me, and it put me absolutely sound asleep. And then I would be in a contraction and then sound asleep. It was kind of a miserable thing. And I've now learned, after seeing my genetic profile, that I couldn't metabolize that medicine. So I was getting way bigger effect than a normal person, than someone else with that genetic variant would not. Somebody without that genetic variant would have tolerated that medicine fine. But I had a way over the top reaction. So if you've ever had an experience with a medicine that just didn't seem right, it wasn't what other people experience, there's a good chance that pharmacogenomics is the explanation. It's almost like a Q-tip in your cheek. It's an easy swab to get the DNA information that can guide your prescribing. So again, insurance is really catching on to this. More and more it's being paid for. If you feel that you don't react normal to medicines, maybe talk to your doctor about getting a pharmacogenomic profile. So to kind of wrap that part up, when you're trying to figure out what is the best medicine for someone to be on and what's the best dose and should you take it once a day or twice a day, a lot of that comes down to how's your liver working, how are your kidneys working, and what are your genes. And so as a pharmacist, and what I do, I get those three critical pieces of information before I even start evaluating your medicines to determine what are the right changes that could make you feel better. So I'm going to stop there for a second, let you kind of process that. And someone is commenting that taking 2 copies of the med list and the questions is helpful. And they feel like that making sure that all the doctors have that information is worth its weight in gold. So thank you for that feedback. I hope that a lot of people find that tip helpful. So several people actually mentioned memory, and as that being a part of aging. And I have to tell you, memory decline is not really a part of normal, healthy aging. It can be the result of some genetic profile, but most often, honestly, it has to do with medications. And in particular, I want you to think of medications that dry. So I got a picture of the desert here. There are a number of different types of medications that have a very drying effect. So think of medicines you might take for incontinence or vomiting or diarrhea or cough and cold when you've got like the weepy eyes and the runny nose. All of those medications not only have a drying effect, they all slow down your cognitive processing and make you feel like you can't think clearly. And then there are a bunch of other medicines, anxiety medicines, depression medicines, things that people use on a pretty regular basis that can also have this slowing of the thinking process kind of effect. So I will tell you that is very frequently one of the things that we address with clients is finding those medications that are probably slowing down their thinking and working with their doctors to minimize those. And some great examples and stories of people who really thought that they couldn't safely drive anymore, felt that they couldn't really manage their own affairs anymore. We made some medication changes and they were thinking very sharply again. Many examples of that. So that is critical. The other thing I promised we would talk about is sleep. Sleep is so important to your overall health. And what I'm seeing right now, especially during COVID, is rates of pain seem to be higher. In some cases, that's because people are sitting more. And when we sit, we kind of get achy and our sciatica acts up and we have more pain that way. So the answer to that is to move more. Other people are moving more and doing odd jobs around the house and hurting themselves. So that's some of the pain. But a lot of times when there's emotional distress that doesn't have an outlet, that can actually feel like physical pain. And when you're in pain, you tend to not sleep as well. And when you don't sleep as well, you don't handle all of these emotions as well, and the anxiety levels go up. And when the anxiety levels go up, the pain feels worse. And when the pain feels worse, you don't sleep as well. It becomes a terrible vicious cycle. And I've talked to so many people before COVID, but even more so during COVID, that are wrapped up in that cycle and really finding it difficult to rest. So I'm just going to cover a couple of tips. Sleep hygiene is what we call it, sleep hygiene tips to help you sleep better. But if this is something that is really plaguing you right now, let's have a phone call and talk about it in more detail. I'll actually use a recent client as an example. She's been having a lot of trouble sleeping and had started taking sleeping medications. I almost never recommend sleeping medications. They increase your risk of falls, and they often have like a residual hangover effect where you still feel sleepy the next day, and the sleep you get with those medicines is typically not as good and deep as natural sleep. So working with her, there were a number of things that we were able to do. One was she was going to sleep watching TV. That tells your brain it's daytime and you're still awake. That white light, whether it's your TV or looking at your phone or your computer, that's sending your brain messages that, woohoo, we are awake, it is daytime, we're still moving. You can't really go, most people can't go from that white screen directly to sleep. You got to give yourself some time in between when you're doing relaxing things. For some people, it's meditation or prayer or a warm bath. The scent of lavender is relaxing for a lot of people. Reading a good book, not necessarily a technical manual, but a good book. Although I will tell you, reading pharmacy journals can put me to sleep sometimes. But finding those things that are not looking at a screen that really differentiate for your brain that, okay, we're done with the day and we're easing into the night now. Another thing that can be helpful is massage. If you've got a partner that would help you with a massage, that can be very relaxing. Or if you don't have that, there's almost like a self-massage process that both calms down all the craziness in your brain that's keeping you awake and makes you feel more relaxed. And that's to start at your feet and work your way up by squeezing some muscles. So like squeeze your toes and hold that, and then very gradually relax it. And then do the same with your feet. Squeeze and relax. And then with your feet, like bend them up all the way and squeeze that and relax, and down all the way. And then move to your calves and then your thighs, and work your way up your body and out to your fingers. A lot of people find that long before they get to their fingers, they've relaxed and gone to sleep. So we call it sleep hygiene, and there's a bunch more tricks beyond that. But if you've not tried some of those things, I highly encourage it. And the last one I'll leave you with on sleep is noise. There, if you look this up on your computer, there's white noise and pink noise and brown noise, and it's just different sorts of noises that sort of can be calming and consistent and allow people to fall asleep. So I encourage you to experiment with some of those and see if any of those allow you to get better sleep. Any questions, please don't hesitate to put those in the list here. I'm going to talk about one more thing and I'll stop for questions. De-prescribing. So when we do find a medication that is impacting thinking, it's very important that it not be stopped all of a sudden. There are a number of medications that need to be carefully titrated up and then carefully titrated back down. And so when de-prescribing is a process, it's the name of a process of figuring out which medications maybe aren't necessary. And then if we're going to stop them, how do we do that carefully and slowly, one medication at a time? Because if we make a bunch of changes at once and something goes wrong, we won't know what caused it. And we're kind of obligated to go back to where we were and start again. So this de-prescribing process, I will tell you that telehealth has really enabled de-prescribing in some new ways. So if you're somebody who's coming off of medication, I can check in with you for a minute and determine how you're doing and whether we're going to make another dose change or stay the same. And even before COVID, we were using this computer communication to do that. And people would talk about how fun it was because they only had to get dressed from the waist up. Otherwise, they could be in their jammies and no one would know the difference. So de-prescribing is that process to gradually remove medicines. If we've got time at the end, I'd love to tell you a really powerful story that relates to some of this. But for now, I'll keep going to make sure we get to the end. Someone else was talking about the benefits of having the 2 copies. So thank you for that feedback. Jeff, do we have any other questions at this point?
No specific questions, Michelle, just a couple of people saying that they have to jump off, but they're going to be following up with you, and just some great information so far. So thank you.
Great, great. Thank you all that need to leave. Thank you for joining us. So telehealth, I would imagine at this point, everybody's experienced it. It was this sort of great unknown for a lot of people back in 2019, but thanks to COVID, most people are having their healthcare provided right now via telehealth. I don't believe it could or should or would ever replace going to your doctor and having a hands-on physical exam. That will always be essential. But boy, between those visits and to bring in some of the rest of us of the healthcare team to kind of come in and be able to add our expertise to the decisions being made, telehealth is opening some beautiful options. So I would imagine a lot of you have had telehealth visits at this point. I've had some people tell me they feel like it's more focused, felt like they were able to talk to their doctor a little bit more directly than they feel like they could in the office. And then a lot of people have appreciated that you don't have to go out and drive to the office and sit in the waiting room and be taken back to the exam room and wait for the doctor. Their total time commitment was so much shorter and the visit was so much more focused. So I hope you've been having some of those positive reactions to some of your telehealth experiences as well. What I do is typically, when possible, provided by telehealth for everyone's convenience. And having done it for a few years, I can usually get the information I need and see the things I need to see by just helping people point their camera in different places as I'm reviewing the information. So I mentioned this before, that I believe within today's healthcare, you need quick access. When something new has happened and you've got to make a decision, you need to be able to reach out and talk to somebody about that. And then when big things happen, new diagnoses, things you're not sure how to navigate, it's important to have someone who knows the system to be able to walk you through that and then coordinate all of your care so everybody making decisions about you is on the same page, working from the right information. Absolutely critical. And then the other piece of that is you being able to communicate correctly and efficiently your information. So I've designed a process that I am excited to tell you about. I mentioned before that I really think retirement and whatever you do in your life, age 60 and beyond, should be meaningful to you. It should be associated with your individual interests. You should stay active, both physically and socially. Should be sustained. And for me, sustained means if you're going to live 30 more years, let's make them 29 and a half really, really great years, and then have that health decline at the very, very end. Or maybe you make it all the way to the very end and never see the decline at all. It breaks my heart to see people that have 30 more years and the decline comes and they spend those 30 years not doing the things that they want to do. I'm all about preventing that. And that means being healthy, this whole coordinated, broader look at what it means to be healthy. So we develop a strategic planning process that results in a MASH map and a very clear, clean collation of all of your health information that any of your healthcare providers could access. So we have a number of tools that help you design the meaningful part of your retirement, the active part, that sustained part, and then several steps coordinating with your healthcare team on the healthy part. And the end result of that is this one-page strategic plan for your retirement, where we've captured what are your priorities, what are the things that you want to do to reach that, and then what are monthly check-in points that you could use personally to say, yes, I'm on target with my plan, or I'm not on target with my plan. Once somebody has gone through this process, I usually check in with them 2 or 3 times a year and just make sure that all of the information stays up to date and that they're doing well with their plan. But then I'm available, whether the sudden acute thing happens or the new diagnosis comes along, then we could always reconnect and walk through that together. So I do have a story for you, but I want to prioritize your questions. So my information is here. You can reach out to me. We can certainly have a free upfront call just to see if I'm a good fit for you. And I wanted to make you aware of a book that came out in October, Preventive Maintenance for a High Mileage Life. So we take care of our cars. How do we take care of ourselves? And it goes into a lot of the topics that we've been able to talk about today and even more. So it's not expensive. It's an ebook out on Amazon. So I encourage you to go get that and take a look. If you'd like a signed copy of a softback book, then let me know and I'd be glad to sign and send you one of these. Just reach out to me and we'll arrange for that to happen. So before I tell my story, I see a question about how important is nutrition. And you're right, a lot of doctors don't particularly have expertise in nutrition. I think healthcare needs to be a team sport, and we need to pull in the people that have spent years and years developing the expertise in each of these areas. And so I know I'm preferentially working with doctors who are open to collaborating and bringing a dietitian in when we need some specific answers and guidance in the area of nutrition, willing to bring in that physical therapist to help you figure out what stretches and moves to do to prevent or treat the pain that you're experiencing. You know, willing to bring in the pharmacist to guide the prescribing, because pharmacists are really the experts when it comes to the medications and how they work. And so I'm all for a very collaborative approach to healthcare. And so on the nutrition side, if it's anything beyond the basics, I would highly encourage adding a dietitian to your overall team. While we're waiting on a couple more of questions, let me tell you this story, because this just happened. We're 1 year from the start of this story right now. So last June, a gentleman in his early 70s who had recently retired, very healthy. He in this case, he lived alone, but he had a lot of friends, and he was a very, very smart person. He was one of these people who could tell you all the sports statistics at any time. So you know he was cognitively very, very sharp. And one day he was on the phone, and thankfully a friend was visiting, and all of a sudden he forgot who he was talking to and what he was talking about. And the friend saw this happen, called the ambulance. He was whisked away to the hospital. It was a weekend, and so the hospital was not able to call his primary care doctor. In this case, they did all the scans and they determined it was not a stroke. And they looked at his medicines, and he was on 3 medicines that can be used for seizures, but in his case, it was not for seizures. But again, the hospital didn't have access to his doctor. He was not in a state to speak up for himself, so they assumed it was a seizure disorder. They sent him to rehabilitation. He failed rehabilitation. He just was not thinking clearly enough to participate. So he couldn't go home. So he went to assisted living and just laid there. And so eventually a team was called in, and I had the honor of going to talk to his primary care doctor. And I'll never forget the minute. This doctor still had paper records, and he opened up the record and looked at his last visit with this man, and a piece of information that had been faxed over from a specialist doctor, and realized that at the same time, his primary care doctor had increased the dose of one medicine at the time that the specialist had started another medicine, and the two of them together had interacted and just basically shut down his thinking. Well, at this point, it's been a few months. And so his primary care doctor and I talked to the doctor at the assisted living. We finally got all on the same page. And then we had to start that de-prescribing process where we gradually stopped. We had 2 medicines, but we could only stop one at a time. So gradually started stopping one, and then when it was gone, started stopping the second one. And with each dose decrease, he got more alert. And to the point that he was thinking very clearly again. He got back up to speed on all the statistics. He was good, but he hadn't walked in so long he couldn't walk. So then it took 3 more months for him to be able to walk out of there, move back into his house. He lost 9 months of his life because 2 medications were changed at the same time, and the people involved did not have a chance to share that information with one another. So I see him as a dramatic example of something that happens too often. And had that not been caught and those medicines not been stopped, he would have stayed in that state probably until he died. And that, that breaks my heart to think about that possibility. All right, so now we have a couple questions. How similar is what I've talked about with holistic medicine? I do think this is holistic. You're pulling all the pieces together, and I think the most effective holistic medicine has the client, the person, the patient in the middle, guiding all of this. So rather than telling them what to do, they're guiding what they want and where their priorities are. And I know the same is true in the legal process and the financial process as well. Oh, good, we have a dietitian on the line. Thank you for being here. If you want to clarify anything I've said, please do that. And that is the end of my remarks. Jeff, are there more questions or anything else that people have mentioned they want to talk about?
We have one other comment. Gentleman saying communication is certainly key. That is certainly an understatement in virtually any industry, including ours, and I'm sure yours as well.
Right. There's this old adage, garbage in, garbage out. You know, if you're
That's right.
starting with the wrong information, you can't draw the right conclusions.
Exactly. And we start most all of our consultations with a questionnaire, which is quite comprehensive, but necessary information in order for us to begin the planning process. So we need that information to begin a good relationship. So um,
Absolutely.
maybe the last thing that people want to fill out, but it's the first thing that's needed. So let's see here. We have another comment from one of our very good friends here at the firm. Excellent presentation, powerful story about the man on too many prescriptions. Thank you, Michelle and Jeff. Well, thank you very much.
Thank you.
And
Kind of another example you're making me think of is the way we describe pain. And I talked about how we kind of guide people to share the right information with their doctor. The way you describe that pain, there are so many words that can describe pain. Is it dull? Is it sharp? Is it achy? Is it throbbing? Does it like stop you from being able to breathe or from able to move? So many those feels like little nuances, but those descriptors make all the difference in figuring out where's the pain coming from and what can we do with it.
another comment, incomplete information is especially dangerous in healthcare.
Very true.
Yeah. So we'll leave, well, actually one more here. Question is, we're advised to eat more protein as we age. Does extra protein interfere with medications? Interesting question.
Oh, that is a great question. If
Yes.
any of my pharmacy students were here, they would be so excited about that question. Most of the time, no, but two exceptions to that rule. One, I mentioned how kidneys can decline. When kidneys decline to a certain point, protein and the amount and controlling the amount of protein becomes essential. And so that's more, not so much medications, but more disease state related. As the kidneys decline to a certain point, protein will be one of the major things that you talk about with your doctor and your pharmacist as you move from that point forward. And then there are certain medications that we call protein bound. So there are some medicines where the level of protein makes a huge difference in how we dose that medicine. There aren't very many of those, but if you're on one of those, then your doctor and your pharmacist are watching your body protein levels very closely.
Very good. So we'll leave it open for questions for a couple more minutes. I'm going to have a couple of closing thoughts. I want to thank Dr. Michelle Fritsch for just an extraordinary presentation, very informative, educational, action-oriented, I would say. Lots of great takeaways. I would just on the spot here love to welcome you back later in the year to offer this again or anything else you'd like to share with our attendees. Just this is one of the best webinars that we've had or any presentation for that matter in a long time. So thank you so much for your time and your expertise.
Thank you for inviting me, and I would be glad to come back. I appreciate you all being interactive with me so much.
Yeah, and thank you to our attendees for the great questions, for being participatory. That really always makes a big difference in our webinars, and especially not being in the same room, just being interactive. It really is very helpful, and it makes a big difference. So thank you very much. And please reach out to Michelle if you have any further, personal questions that you want to have addressed, or if you'd like to schedule a time to talk further with Michelle. I'm sure she'd be happy to do that. We're here as a resource for you too at Elville and Associates. Again, our offices are open. We're staying busy. We can talk with you by video, whatever you prefer, or here at our offices, we've got conference rooms that we're maintaining, certainly strong safety protocols to help you with all of your planning needs. So very happy to be a resource to you as always. So thank you. Any other questions here? Let me check. We have a comment from our good friend. I concur that Dr. Fritsch should be an occasional presenter. So I agree with that. So I think we'll go ahead and end on, well, actually, see here. Okay, here's a question. How do you get the MASH map info, or is that in the book?
The MASH map is part of the process, working with me with retirement wellness strategies, but the concepts are in the book.
Okay, very good. I did publish the link to the book down in the little chat feature of the dashboard. In my brief follow-up, I will be sending out a video for today's presentation tomorrow when that becomes available. I'll also include the link to the book if anybody's interested. I have a copy. It's a good read, very informative, so certainly encourage you to take a look at that. So I'll send that link out as well, along with the video link if you want to share today's presentation with anybody that wasn't able to attend. Okay, any last thoughts from anybody? Going once, going twice. Okay, well, I think we'll conclude and say this is a successful webinar. Thank you so much, Michelle.
Thank you
really
for having me.
Appreciate it. And everybody stay safe out there, stay well, please. And we look forward to seeing you again very soon. Reach out to us with any questions or comments, okay? And you also are gonna get a survey in a few minutes. Please go ahead and respond to that. Give us your thoughts on today's webinar and any other feedback you'd like to provide to us. Thank you as always. Have a pleasant day.
Bye.